Hi, my name is Bertalicia Guerrero. I'm the Director of the Office of Intergovernmental and External Affairs. It is such a pleasure to kick off Pride Month with all of you here today at the U.S. Department of Health and Human Services. Over the past 3 years, to mark this occasion, Secretary Javier Becerra has raised the Intersex Progress Pride flag. We're proud to be the first federal agency to do so and are excited to continue that tradition today. We will begin our program with remarks from two very important leaders from the LGBTQI plus community, and then we'll turn it over to Secretary Javier Becerra for remarks and the raising of the flag. And now it is my honor to welcome and introduce Assistant Secretary for Health, Admiral Rachel Levine.
Well, good morning and happy Pride. Happy Pride is very exciting. Yes. So I am Admiral Rachel Levine, she, her pronouns. And I am very proud to serve as the first openly transgender Assistant Secretary for Health and thank you. And Senate confirmed appointee to federal office and 4-star officer across the uniformed services. It is truly an honor to be with Representative Takano here, as well as Secretary Javier Becerra, both from California, I might add, to be speaking today. I just also wanted to introduce, and Lieutenant Commander, if you could go over there, Lieutenant Commander Johnson from NIH, and our newest member of the Public Health Service Commission Corps, Lieutenant Commander Abigail. Lieutenant Commander Abigail is our Public Health Service Public Health Service Commission Corps facility dog. She is here with a generous donation from Warrior Canine Connections, and she comes with us with many events and to visit hospitals and children, and is really a great addition to the Public Health Service Commission Corps. So again, happy Pride, and at HHS we work every day to benefit the public, to protect people from harm, and to make our communities whole. And we do this with empathy, we do this with compassion and understanding, and we see people and hear people without discrimination. We strive to provide care and services without bias, prejudice, and stereotyping so that individuals and communities feel seen, heard, and cared for. We, of course, do recognize that certain populations experience health disparities and challenges to access to care, and we are working to achieve health equity, certainly under Secretary Becerra's leadership, the attainment of the highest levels of health for all people. And we all have a role to play in making progress without leaving anyone behind. We must continue to strongly advocate for the most underserved and marginalized in our community, including trans individuals and individuals of color. The Progress Pride flag is a variation of the rainbow pride flag that includes black and brown stripes to represent marginalized LGBTQI plus communities of color, along with the pink, light blue, and white stripes to represent the transgender community, as well as the golden yellow field with a purple circle to represent intersex people. This is the second year in a row that we have been flying the Intersex Inclusive Pride Progress flag. And this represents intersex people intentionally avoiding referencing gender stereotypes and avoiding symbols that really have anything to do with gender at all. Instead, the circle is unbroken and unadorned, symbolizing wholeness and completeness, because intersex people, like all of our LGBTQI plus family, everyone on the rainbow and on the flag, continue to face significant health disparities and barriers to achieving health equity. So while we continue to make progress, we have more work to do to truly transform healthcare to support LGBTQI plus individuals and address the multiple disparities that persist, particularly for people of color, our African American Black community, our Hispanic Latino community, and the American Indian Alaska Native community, and the AAPI community, as well as people with disabilities, older adults, young people, and others. We are stronger together. We are stronger together. So now it is my pleasure to introduce Representative Mark Takano, who represents the people of Riverside, Moreno Valley, Drupa Valley, and Paris in the United States House of Representatives, and serves as a ranking member of the House Committee on Veterans Affairs and a member of the Education and Workforce Committee. Congressman.
Thank you. Thank you. Thank you. Well, good morning and happy Pride, everyone. And thank you, Admiral Levine, for that very warm introduction. You have been a genuine inspiration to me and so many others across the country. Let's give a round of applause to Admiral Levine.
Thank you. Thank you.
Now, Pride can be a month, Pride Month can and should be filled with joy and celebration and boas, but it's more than that. It's a moment to reflect on how far we've come and how far we still have to go. Now, as a young man, I'd watched legislators in California and people who qualify initiatives for the ballot cause TV debates on whether gays and lesbians should be allowed to teach in public schools. Just a few years later, I myself became a teacher. Spurred to make a difference beyond the classroom, I ran for Congress in 1992. And guess which other Californian heard the call to serve at the federal level? None other than Secretary Javier Becerra. Now, the Secretary fared better than I did. While he won handily, I lost by 0.2 percentage point. Eager to try again, I ran my second campaign for Congress only 2 years later in 1994. That's 20 years ago. Unfortunately, I was publicly outed by my opponent and made the target of homophobic attacks. I would lose that race by more than 18 percentage points. And while I was initially discouraged, I did not give up. I went back to teaching and stayed active in my community. And 2 decades later, I once again threw my hat into the ring. Some question if I was the best fit to run in this battleground seat. The carefully worded way of asking, can a gay man win? After all, I lost by 18 percentage points the last time I ran. And well, with some hard work, I'm happy to say that in 2012, I won by 19 percentage points. And with that victory, I became the first openly gay person of color to serve in Congress. The first Gaysian, we could say. We've come a long way since then, and the progress towards equality that we've made is the result of battles that have been fought for the civil rights of LGBTQ+ community over the course of decades. But we have so much further to go, and the Biden administration gets this, using both the bully pulpit to increase visibility and their policy-making prerogatives to strengthen our laws. But we can do more because LGBTQ+ rights are under attack in state capitals and in Congress. Just last year, these extremists introduced more than 500 anti-LGBTQ+ bills across the country. The solution to all of this is to pass My Equality Act, a comprehensive bill that would extend LGBTQ+, the community, the same civil rights as other Americans enjoy. So, thankfully, LGBTQ+ people are not alone in this fight. We are lucky enough to have allies who stand shoulder to shoulder with us. Under President Biden's leadership and Secretary Becerra's stewardship of HHS, we have seen real progress. The President signed into federal law the right for all people to marry who they love. And HHS now explicitly provides for non-discrimination protections based on gender identity, sexual orientation, and sex characteristics. And so, it is my great honor to introduce a stalwart ally of the LGBTQ+ community, my friend, and our HHS Secretary, Javier Becerra.
Congressman Takano, thank you for never giving up. I remember 1992 when we both ran. I remember how close you came. And I remember the following race and how different it was simply because information became public. The great thing about Mark Takano is he has never stopped teaching. He may not be in a class anymore, but he continues to teach so many people in America what it means to have equality, what it means to stand up. And we are very proud to have Mark Takano serve in Congress and be such a leader for so many of us throughout this country. So, Congressman Takano, thank you very much for being with us here today. Admiral Levine, I just have to say that under your stewardship, we have really made it clear that public health is available to everyone, and we will stand up for the right to access care for everyone at every moment in time. And we say that not just in practice, but we will do it in policy as well. And so we are very proud that we continue to make the gains that we need to see for so many Americans. Why should it be that if you seek to access health care, you could be deprived that care simply because of who you are? And that's why we've made it very clear in Section 1557 of the Affordable Care Act, the anti-discrimination provision in the ACA, that everyone is protected. Every American has a right to access care that they need, no matter who you are. And we're going to make that very, very clear. But we didn't stop there. For the first time in close to 5 decades, we've taken a look at the Rehabilitation Act, Section 504, which for the longest time was the principal means of protection for Americans with some form of disability. And we know that many people were discriminated for any number of reasons. And so what we have done is taken Section 504 and said that everyone should access the care that they need, so that you can't treat someone a little bit better because they seem to be more normal to you than someone else. And whatever form that takes, we're making sure under Section 1557 of the ACA or under Section 504 of the Rehabilitation Act, we're going to protect your access to the care that you need. But we went even further. After we successfully established 988, the Suicide and Crisis Prevention Lifeline, that now more than 9 million Americans have accessed, we're making sure that everyone who calls receives the attention they need and hope. And so that's why part of the several hundred millions of dollars in investment that President Biden made in 988 includes $70 million, which is there to make sure that people from the LGBTQI plus community, when they make that call, when they do that outreach, they can reach someone who will have an experience or training to address them the way they most wish. And so we're going to do everything we can, whether you're a veteran, whether you're limited English proficient, whether you're hearing impaired, whether you're LGBTQIA+, that you have the person that you need to professionally help you get through your crisis. We didn't stop there. We've also made sure that we reached out to folks going through very difficult mental episodes who need the care or may be going through an addiction. And we made sure we outreach folks using people who understand the experience of those communities. Oftentimes that means a young American. Oftentimes it means a young American who's been cast out because of their LGBTQIA+ status. And so it should be no surprise that we're doing more to help reach out to young people. And especially in the foster care program, we've changed it so today, if you're in the foster care program, you must receive care that's appropriate for your needs. Not just the placement home's needs, but your needs. All those things may be tiny in the eyes of many Americans, but for us it's not. Because it means we are elevating what it means to protect your access to care. It means we recognize how we have to enhance your ability to walk through the doors of any place and get the care that you need. And that's why it should not surprise you that we were the first department in the federal government to raise the Pride Progress flag, as we will do again today, because what we want to do is signal to everyone in America that we are not afraid to show where we stand. We are not afraid to protect those who wish to access their health care. We're going to lift that voice high, and we're going to lift the flag today very high to make it very clear. At the Department of Health and Human Services, we respect you, we elevate you, and we will do everything we can to make sure that you thrive in the United States of America. One way we do that is so that as people pass by this department, they see that we do with pride the protection of all Americans when it comes to access to health care. We are very fortunate to be able to do this. You're going to have a great summit in just a few minutes to talk about all the work that's being done to protect every American in their access of care. I want to just single out one individual who has done a tremendous job in the state of North Carolina. The Secretary of Health and Human Services, Cody Kinsley, is here with us today. He'll be on one of the panels, but I want to single the work that he has done. Not only is Pride Month important to him and the work that he does, but he has successfully engineered what Governor Cooper made possible for close to, I think, more than 600,000 North Carolinians. That is access to health care under the Affordable Care Act, because the state of North Carolina expanded Medicaid. And today, 450,000 plus of those 600,000 plus North Carolinians have already, in less than 1 year, received secured health insurance coverage under expanded Medicaid. Secretary Kinsley was behind that effort. He's the guy that ran the operations to make it possible in North Carolina. He's here today to participate in the summit. We are proud of Americans who do right by their fellow Americans, but we're also proud of those who stand up and show their pride in who they are, and that's why we're very proud to have Secretary Kinsley with us, among all of you who are going to be participating in the panel. Thank you very much for what you do. Let's show our pride, let's lift this flag, and let's show America who we are. Thank you very much. Countdown. Wait, it's already gone. 5, 4, 3, 2, 1, go. No mistaking where we are. Thank you all very much.
Produced by the U.S. Department of Health and Human Services.